Cindy Hodgson with Essential Therapies. We're going to talk about self-treatment with the small rubber air-filled balls. So one of the things I use these balls for regularly on myself is to loosen my abdominal area. And I've had 2 C-sections, so I have a lot of scar tissue in my pelvic region. And I've had different types of pain and problems associated with that. What I have found over the years of using these on myself and with patients is that they're really an indispensable part of my self-treatment. What we're going to do is use the ball on the belly and lay on our belly. So I'm just going to show you first where I put it, and sometimes I use 1 ball, sometimes I use 2. And you don't have to just use these balls on the belly, but that's what I'm going to start with. So I'm going to begin by taking the ball right around the area of my scar, which is here, and not on the bone itself, but up into the soft tissue, and then I'm going to lay on it, on my belly, and find a comfortable place where I can do that, and then soften and relax into it. Now, if you are using the ball and you have a lot of discomfort from it, that is a sign right away to stop where you are and to move the ball. There are a few different things you can do. You can find a softer space to use the ball. So right now I'm going to be using it on a firm surface, but I usually use it in the bed with me just because it's easier to do when I'm waking up in the morning or when I'm falling asleep at night. So I use a more firm ball on the surface of my mattress because that's soft. When I'm doing it on a hard surface, I will tend to use a ball that's a little bit softer. You also do not want to use the ball over any hernia area or an area of mesh. So you can go away from that area in the abdomen, but you can still work and treat the fascia by not being directly on those affected areas, okay? So what it looks like is this. I'm just going to take the ball onto my lower belly and find a spot, and usually it's the right side of my scar that's the worst. So I'm finding it here. Now there's a real tender spot, so I'm not going to stay there. I'm going to move a little bit and find it there. Okay. So now I'm just going to rest in this area. So I'm feeling it kind of soften into the space right now. It's a little bit uncomfortable, but I usually wait about 30 seconds to see if it's going to soften enough, and it did. So it feels pretty good right now. Actually feels really nice. I can feel this pulling all the way into my low back, which is where I will often have discomfort if I don't keep up with the use of this ball on a regular basis. So what I would do normally is just stay here for several minutes, working up to at least 5 if you have never done this before. And a lot of times I'll stay even longer just because it feels so good. The other thing is you can move the ball just without even, getting up and moving it. You can just shift your body back. So I'm going to roll down a little bit. Now the ball is still pulling on that same area in a slightly different spot, and now I feel it engaging more tissue and getting a little deeper right near the edge of my ilium here. Oh, that feels really good, and up into this area of my low back. And it's not painful, but it's just that hurts good feeling, if you know what I mean. So I would stay here for quite some time as well. Again, going into that channel 3 space, relaxing and letting go, letting the body release in a healthy, safe way. Listening to any signs of your body telling you you've been here long enough as well. And you can do that all throughout the abdomen. You can even go up closer to the rib cage, or then move over to the other side of the body. That's a surprisingly tender spot right there, so I would stay there for a little bit. Again, when I say tender, it's not unbearable. It just feels like it needs work. And as I'm staying here a little bit longer, it's starting to soften into there, and I can tolerate that, so I'll stay here for a while. So that's the use of the ball on the belly. It's great for scars. You can also use the ball in other parts of the body. And one of my other favorite places is to use it for the glutes. And I will usually take 2 balls to do that. So I have it at the same side across on the pelvis on the other side. If I did just one side here and I stayed here long enough, which is what our goal usually is, I may end up shifting my pelvis because my pelvis has a tendency to be mobile. So I want to do it evenly on both sides. And then sometimes we use the balls specifically at a different place to help with releasing the pelvis to bring it back into alignment, but that's something you would do with the help of your therapist. So this feels really good now, getting into the glutes and a lot of the tightness there. Also the piriformis. So you can roll over onto the side and just get the one side here. So you can't really see it, but it's underneath my hip, but not really on my hip joint, more on the gluteus. So maybe able to roll this way so you can see what I mean. And there's a really tender spot there. And then you can also work the ball all the way up your back if it feels comfortable. You can use 2 balls like this, roll it down, find a good spot, and then hold it. Because remember, if we're rolling, that may feel good, but it's not going to do a myofascial release like we've talked about the myofascial principles. Another position that I like a lot for the use of the ball is the hamstrings. So right underneath that sit bone is a good place. And it's also nice if you have something to lean against, just to let go a little bit easier. And then you can also use the balls under the upper trap. Like so. And I'll often put something to support my head. Oh, that feels good. Getting some good pressure into the tightness in my upper traps. But again, holding these as long as it's comfortable for you, listening to your body, waiting for hopefully 3 to 5 minutes or longer if it's comfortable, and enjoy the release. These balls are 4-inch air-filled rubber vinyl balls, and a lot of myofascial therapists have them. I have them at my clinic space, and sometimes you can find them in the dollar store or kids stores. So hopefully that gives you some self-treatment information that will be useful, and I look forward to answering any questions that you might have. Thank you.